So I'm Chris Laugen, and we moved up into Bellingham in May of 2019. We chose Bellingham because I'm a graduate student at University of British Columbia. I'm finishing my doctoral degree there.
My name's Eileen McCracken. I retired early in 2020 after having worked at oil refineries in Whatcom County for almost 15 years.
My name is Mark Wheatley. I am a case and contact investigator for the health department.
The pandemic had a huge effect on the plans that my husband and I had for our retirement. We wanted to travel, we wanted to just have time to drive up and down the coast and camp and visit friends, and suddenly we weren't able to do that. And somehow I heard about the contact tracing and the need for volunteers, and I realized that this was a really good opportunity for me to help. The best calls for me are the calls where I call someone who is nervous or afraid, and I share what I know about COVID-19 and am able to help them put together a plan so that they can protect their family and their friends. By the end of the call, they may still have a lot of uncertainty about how their virus is going to progress, but at least they have a plan to be safe.
So the most rewarding aspect for me of doing this contact tracing has been when I get somebody at the other end of the line who at the end of the conversation says, "You're doing great work, we really appreciate what you're doing, thanks for your hard work." Then you kind of take note and you realize, okay, people are noticing that we're out here doing this.
Contact tracing is it's more intensive. There's always something to do. I always have lists of people to call. I can very rarely say I'm finished, I'm done. I'm done early today.
I, by nature, am not the most outspoken person, so sometimes, seeing a list of 3, 4, 5 people I'm going to be calling on the phone is kind of intimidating sometimes. But I think the most challenging part is when the people just don't really want to hear from you.
It is a big impact. It is a big thing to ask somebody to stay home for 10 days or 2 weeks, but it's really important.
Contact tracing has been used for a number of years, so it's nothing new. I think most people maybe don't understand that because we haven't been in the midst of a pandemic anytime recently. It's really crucial, along with testing, to stop the spread and make sure people don't keep spreading it throughout the community.
I feel contact tracing to slow or stop the spread of COVID-19 is an essential part of getting through this pandemic. It's not the only part, but it's a big part, and it needs a lot of people. It needs a lot of attention. This is not easily automated. This kind of work requires volunteers and really everyone. We need more people doing this.
If you're thinking about volunteering, you should just do it. There's going to be a lot of education that will be shared with you about the virus and the health department and the resources in our community. There will be a lot of time for you to listen to other calls so you can start to formalize those words in your head for yourself, and then you will have a chance to practice in front of a supervisor and get some feedback. And then even through all of that, when you're on your own, help is always just a phone call or a message away.
If you value, helping people understand the pandemic and getting that message about how we can stem the spread, then this would be a great opportunity to help out.
Knowing the source of infection and the possible spread of infection is essential.
It's important to remember that what we're trying to do is to help stop the spread. And with your trust and your cooperation, we can do that a lot faster than if we just let it go unchecked.